Inflammatory bowel disease. Ulcerative colitis and Crohn's disease comes under inflammatory bowel disease. It is seen in young females and it is a abnormal immune response to the gut bacteria, thereby causing immune dysfunction. And so it is not a autoimmune disorder. First, you have to remember that point. It is not an autoimmune disorder. There will be extra intestinal involvement involving the skin, joints, or other tissues. First, we will discuss Crohn's disease. In the Crohn's disease, there will be ileal disease with serpiginous ulcer. This is a characteristic feature of Crohn's disease. Any part of the gut is involved in Crohn's disease, but the most commonly affected site will be ileum. In Crohn's disease, rectum is spared. You have to remember that point. Most common site is ileum and rectum is spared. There will be presence of skip lesions and transmural inflammation is characteristic of Crohn's disease. Earliest manifestation will be aphthous ulcers. There will be cobblestone appearance. As shown in the picture, there will be cobblestone appearance because of the edema and swelling of the affected mucosa. In between the normal mucosa will give a appearance which is irregular and it is called as cobblestone appearance. And the bowel walls are fragile, resulting in fistula formation. The most common location will be perianal region. So, perianal fistulas are common in Crohn's disease. There will be extensive fibrosis can which will lead to the intestinal obstruction. So, obstruction of the bowel is because of the extensive fibrosis. Contraction of the fibrous tissues will pull the intestine with mesentery, giving it a creeping fat appearance. Or creeping fat appearance is characteristic of Crohn's disease. Okay, so skip lesions, transmural inflammation, aphthous ulcers, ileum is the most common site affected, rectum is spared, serpiginous ulcers. These are all the characteristic features of Crohn's disease. In the radiology, you can appreciate a feature characteristic to Crohn's disease called as String's sign of Cantor. String's sign of Cantor. There will be non-caseating granulomas and basal plasmacytosis, that is increase in the plasma cells. Two more features on microscopy, non-caseating granulomas and basal plasmacytosis. As a result, there will be increased risk of colon cancers. Clinical features will be there will be colic abdominal pain, blood in the stools, watery eyes, photophobia, pyoderma, gangrenosum in the skin, and there will be skin lesions associated with certain deposits called as metastatic Crohn's disease. So, again we will discuss Crohn's disease. It is a inflammatory bowel disease and it is not an autoimmune disorder seen in young females and it is because of immune dysfunction. The most common site affected in Crohn's disease will be ileum and rectum will be spared. The most earliest manifestation will be aphthous ulcers. There will be cobblestone appearance, creeping fat, skip lesions, transmural inflammation. Grossly and microscopically, there will be crypt distortion, non-caseating granulomas, and increase in the plasma cells. On radiology, there will be string sign of Cantor. Ileal disease with serpiginous ulcer, Crohn's disease. In a nutshell, if we say The mnemonic for Crohn's disease will be told by many of them as sister. S for skip lesions. I for ileum is the most common site. S for string sign of Cantor and radiology. And T for transmural inflammation and wall thickening. And E for extra fibrous fistula formation. And the most common location will be perianal fistulas. And there will be sparing of the rectum. R for rectum. S for skip lesions. I for ileum. S for string sign. T for transmural inflammation. E for extra fibrosis and fistula formation. Perianal fistulas. R for rectum spared. You can appreciate the string sign of contour. Here narrowed and this is enlarged. So this is like a string sign of Cantor. And you see grossly there is cobblestone appearance because of the edema and because of the creeping fat of contraction of the fibrous tissues. You can see creeping fat here pulling to one side. And grossly there will be skip lesions, transmural inflammation, perianal fistulas and microscopy, rib distortion will be there, and non-caseating granulomas. Non-caseating granulomas. And there will be increase in the plasma cells. Ulcerative colitis. This is also a inflammatory bowel disease next to Crohn's disease. In this, rectum is involved. Rectal disease with ulcer is ulcerative colitis. In Crohn's disease, rectum is spared. So there will be retrograde continuous spread, that is beginning from rectum to descending colon to transverse colon and to ascending colon. Sometimes total colon is affected, then it is called as pancolitis. And if the ileum is also involved in severe disease, then it is called as backwash ileitis. Inflammation is very limited to the mucosa and submucosa. So there will be formation of superficial ulcers. So superficial ulcers are characteristic of ulcerative colitis. When compared to Crohn's disease, there will be decreased chance of fistula formation in ulcerative colitis. There will be pseudopolyps arising from the unaffected mucosa and will contain only mucosa and submucosa. The helper cells, Th2 cells, are involved. As a result, there will be no granuloma formation. Non-caseating granulomas are seen in Crohn's disease and they are absent in ulcerative colitis. Toxic megacolon. In transverse colon, due to toxins, there will be increase, decrease in the neuronal activity in the muscle layer. As a result, there will be no peristalsis and there will be accumulation of the intestinal contents and thereby rupture. So, toxic megacolon can be seen in ulcerative colitis. And the characteristic feature of the ulcerative colitis is crypts abscess. There will be edema of the mucosa causing the loss of harsh striations, giving the appearance of lead pipe, lead pipe appearance or lead pipe sign on radiology. String sign of Cantor is seen in Crohn's disease. Lead pipe sign is seen in ulcerative colitis. Here also the clinical features will be there will be colicky abdominal pain, blood in the stools, sometimes features of obstructive jaundice related to PSC, that is primary sclerosing cholangitis. And here there is increased risk of colon cancer. In this cancer proning, both ulcerative colitis and Crohn's disease have same risk. So once again we will repeat, rectal disease with ulcer is ulcerative colitis. There will be superficial inflammation, there will be crypt abscess, pseudopolyps and lead pipe sign and toxic megacolon. These are the characteristic features of ulcerative colitis. There will be no granulomas in ulcerative colitis. In the picture, you can observe Crib's abscess in ulcerative colitis. And you see on radiology, it is like a lead pipe appearance, which is characteristic of ulcerative colitis. And the inflammation is superficial only. So acute superficial inflammation and crypt abscess and distortion of the normal crypts and decreased number of crypts are the characteristic features of ulcerative colitis. Both Crohn's disease and ulcerative colitis have equal risk for cancers.
Like, share, subscribe Dr. Ravichandra official for more interesting videos on pathology.